I didn't know what to do. I didn't know how to stop the bleeding, and it was really bleeding.
Coming up on the Morning Medical Update, an unexpected complication of varicose veins. But can it happen to just anyone? How to know if you're at risk and when to seek treatment. Good morning. It is Thursday, November 3rd. I'm Jessica Lovell, and we are live inside the Dulcie Simons Jr. Family Broadcast Studio. Varicose veins can be painful, unsightly, and sometimes a signal of a more serious condition. Our experts will tell us what we need to know coming up today. So get your questions sent in to us on the links here on your screen, or you can drop them in the chat thread below. We'll get to those in just a bit. Well, we've all seen them, and some of you may even have them. Dark blue, swollen, twisted veins that can make your legs feel heavy and tired. Too much standing, too much sitting, and varicose veins can hurt. Many people learn to live with them, like Bob Trapp, until one of his varicose veins ruptured.
This is a really good section here.
Bob Trapp is living his dream.
And it's my home. So coming to work every day is like going home to see your family.
He loves fashion, design, home decor, gifts, flowers, and event planning. And for more than 50 years, he's done all of that under the umbrella of his empire at 41st and Main, Trapp & Company.
And we sell more Trapp private garden candles than anyone in America. But you have to look at these. We just got these crazy t-shirts.
It's where you can find Bob all day long, sometimes 7 days a week, running the show.
These are free spirit roses. Your eye sort of tells you that's the length that you want it to be.
He's always been on the go and in stellar shape, which is why what happened to Bob recently was so unsettling. He remembers he had just gotten out of the shower.
And I looked down, and the shower was covered, the floor was covered in blood, and my ankle, it was just sort of spraying out like that. And I freaked out.
Who wouldn't freak out? But Bob had the presence of mind to get a towel, wrap his ankle, and call his neighbor, who suggested he call his cardiologist. It was great advice. His cardiologist sent him directly to the University of Kansas Health System's Center for Advanced Vascular Care. That's where Bob was surprised to learn what was happening to him was something that could happen to anyone with varicose veins.
The veins were so close to the skin outside that just touching them almost, they would break.
At 84, he'd had varicose veins since he was in his 60s and had mostly ignored them.
You know, they didn't bother me, they didn't hurt, they're ugly, and you didn't let your legs be exposed to the swimming pool.
The fix was relatively simple. Remove the veins that were closest to the surface.
The technicians told me all about it, how they were going to do it. I couldn't quite believe it, but it was wonderful.
So wonderful and so quick that Bob was back on his feet full-time within a couple of weeks. And he has no plans of ever slowing down voluntarily.
People say, "Are you going to retire?" I said, "No. My prayer is that I fall over at my desk and boom, that's it, and it's gone." I like coming here. This is my love and passion.
And we are thrilled to have Bob Trapp joining us here in studio today, along with his vascular surgeon, Dr. Rick Arnspiger. We also have Amy Mahaffey. She is the clinical program director of vascular services. Dr. Arnspiger and Amy work at our Indian Creek campus at the Comprehensive Vein Center. And just a side note, this center was the first in the metro area to be accredited by the Intersocietal Accreditation Commission, which means these experts are the top of their field. So again, thank you so much for being here, Doctor, and Amy, and driving over with us. And of course, Bob, thank you for being here in studio with us.
Thank you for letting me come.
Okay, well, I want to start with you. Bob, did doctors ever tell you what caused your varicose veins? Did anybody in your family have them?
No, not that I remember, but yes, they told me, because I stand on my feet for many, many years, that probably had caused it. And that's why I was having the trouble.
So, Dr. Arnspiger, are varicose veins hereditary? If mom or dad had them, am I more apt to have them?
Yes, there certainly is a genetic link, although a lot of times the varicose veins are acquired. If one of your parents has varicose veins, you have a 40% chance of developing them. If both of your parents have varicose veins, then that chance increases to 90%.
All right, so Bob, why did your friend tell you to reach out to a cardiologist? What prompted them to advise you to do that? Did you have heart troubles?
Yes, I at one time had an AFib, and I think that they thought that was the first direction I should go.
So what is the heart connection, doctor? Why would someone think that maybe, is there that connection there? And why might somebody be concerned?
Well, there really is not a direct connection between the arterial system and the venous system. They are separate. They have different risk factors for developing each. It is possible, though, that patients with large varicose veins, because of the compliance issue with the veins, they can cause issues with the heart.
So regardless, good thing he picked up the phone and made a call to someone.
Yes, definitely.
So Amy, we read that varicose veins are not considered like a serious condition, but can signal circulatory problems, cause a person's blood pressure to go up, and they've been linked to blood clots. So Bob's veins ruptured in the shower. That all sounds serious to me. That would be very concerning. I'm sure it certainly was to Bob, as he mentioned. Explain how a person might discern if their veins are something that need to be made a phone call on, or just a nuisance.
Sure. Varicose veins are really weakening of the walls of your veins and the valves of your veins, and so when those walls of the veins become weaker, the veins expand, and blood can pool in those veins and cause problems. And so sometimes people have trouble with swelling in their lower extremities. They have a significant amount of pain, and sometimes, like Bob said, the skin becomes so thin that sometimes they can rupture. Really, seeking any further treatment really depends on symptoms. So if people are having a significant amount of pain, trouble walking, and not being able to get around much, then they really need to seek medical attention.
So Amy, are all the procedures for fixing varicose veins, are they the same? Or does it depend what yours look like or what stage they're in?
Sure, they are not the same, and really, there's several different procedures that you can use to treat veins, and some of them are done at our center, at the Vein Center, Advanced Vein Center, by nurses that can manage spider veins with sclerotherapy. But also, treatments are laser ablations and also some minor surgical incisions that are done for some procedures. Really, the benefit is that some patients need more than one procedure, and at the Vein Center we have board-certified vascular surgeons that can help manage those procedures, as well as interventional cardiologists and interventional radiologists. So we really have a multidisciplinary approach to all different kinds of vein issues.
So Dr. Unzweiger, I want to ask what you did to fix Bob's problem, but we are going to show some video of the procedure. So if you're a bit squeamish, you might want to turn away for just a moment. But tell us and take us inside that procedure room and exactly what you did.
Well, the problem that Bob had was essentially a problem that a lot of patients get as they get older. They develop spider veins and varicose veins. And this is due to an issue with the structure of the veins, them becoming incompetent and becoming pressurized. And veins aren't able to withstand that pressure. So what happens over time, as the skin atrophies and gets thinner and these veins get larger, they can spontaneously rupture, which is what happened to Bob. This is a complication of varicose veins that certainly is not uncommon. What we're doing, what I did for Bob was two things: essentially removing the varicose veins in the area where he bled, which is what we're showing here. This is done with local anesthetic through a small needle hole, which will not leave a scar. It's minimally invasive. The second procedure that we did was actually injecting the culprit spider vein with a sclerosant medication, which damages the inside of the vein and causes the vein to then collapse, and the body just absorbs the vein with time. So the combination of those two procedures is what Bob required, but every patient is a little bit different, and we customize treatment based on the presenting complaint and problem.
And we will say this is not Bob, and that was the medical description, doctor.
Yes.
Bob, tell us, you have an interesting way of describing what it was like when they pulled that vein out. Tell people what it felt like or looked like.
The doctor said you won't feel really pain, but there'll be pressure. And that was very true. It was not painful, but I did feel pressure. Well, it was like watching a piece of spaghetti come out of your leg. I only watched one, and then
you turned away?
I closed my eyes.
So what was the recovery like? So you go home. How quick did you feel a difference?
I would say within a week. I mean, it was right away. I felt it felt much better. Yeah, it didn't take long. It's amazing. It was truly amazing.
Would you have done it sooner? Had you ever thought about doing it sooner, or was it this rupture that you're like, okay, I mean, now we're in serious territory? Or did you feel visually that you wanted to get them checked, or did it just not bother you?
It didn't bother me. At my point in life, I'm not out at the swimming pool showing off my legs, so I didn't even think about that. But when I looked down and the shower was covered with blood, yes, it did freak me out.
That would have freaked anybody out.
Then I knew something had to happen.
Well, I want to talk about age, because you said you're in your 80s, but you first saw them in your 60s. I married a man that he was 41 when we met, and he had them. So let's talk about the age, and maybe Amy, you can tell us and just talk to us about what kind of age do you see? Is it unusual to see people with them in their 40s? I just thought maybe it was something hereditary my husband had, but he finally did get them fixed, probably more for the visual purpose, but that seemed kind of young.
Absolutely. Absolutely. Well, they definitely have an increased incidence of varicose veins as you get older, and there's different types of things that can irritate or cause a little bit varicose veins. And I think that, as Bob said, standing for many, many years is part of that. But sitting for long periods of time, sitting with your legs crossed for long periods of times, if you have a job that those kinds of things happen, you're more at risk of having varicose veins, as well as having a bit of a family history, as Dr. Arnsperger mentioned, but a less active lifestyle and maintaining a healthy weight is really important, and having an active lifestyle also helps with the integrity of those veins.
So once the doctor, if I can say, once the spaghetti noodle came out, does this mean that is gone forever? Or could he have this incident in the shower happen again with another one?
Well, it's unlikely, because part of our assessment involves ultrasound imaging of the long veins of the leg to detect structural abnormalities, and if that's present, then we address that with minimally invasive catheter-based techniques. That, in combination with the techniques that we use on the skin surface, makes it very unlikely, less than 5%, that he would ever have this issue again.
We're going to get to community questions in a moment, but if you're wanting to know more information about what we've been talking about, or more about the Centers for Advanced Vascular Care, we put a QR code up on your screen, so you can just hover over that, click on it, and find out more information. I want to ask Bob in just a moment, because I want you to talk about your business. I'm so interested. It's such an interesting field that you're in, and I want to tell everyone about that. But let's take a quick check with Dr. Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID count and some headlines this morning.
Yeah.
Good morning to you.
Yeah, hi.
Hi.
So right now in the hospital, we have 26 active infections, just bumped up a little bit. 4 in the ICU, 1 on the ventilator, still 20 in that recovery period as well. So it's being called COVID variant soup.
Yeah.
The same mutations that are coming up again and again, making it hard to predict what we might see as a winter surge. Are there any way to track some of these patterns?
You know, we just need more surveillance out there. We need more global surveillance for the sequences. A lot of these sequences we're really basing on the spike protein, and I can imagine it is very difficult for most people to keep a handle on what the variants are, because now we are seeing so many. Most recently we had Delta and then Omicron, and then from those we had the Omicron sublineages as well, and now we are getting this what's being termed the variant soup. It's certainly reasonable. Understand again, the spike is different in these variants, and that is what helps evade those antibodies that we've had from vaccination or natural infection, but also understand that there are some of those parts on the spike protein that really have not changed too much, and that is what we are able to continue to have our T cell immunity for that major protection against hospitalization and severe disease. But also remember that with all these variants, currently, we are still able to give remdesivir and Paxlovid, especially in that outpatient outpatient setting. But we are continuing to monitor the ability to still give those monoclonal antibodies for treatment of SARS-CoV-2 as well. So those are really the main points when we're talking about this, the variant soup.
Oh, wait, Dr. Hawkinson, I was trying to set up a play date yesterday for my 6-year-old son, texting a mother, and I said, do you want to get the kids together? She goes, our entire house has been hit with RSV.
Yeah.
So Pfizer says it has enough promising data on its RSV vaccine designated to protect newborns that it will end enrollment in the study and then now submit for FDA approval by the end of the year. What does this mean for just overall a vaccine coming about for RSV?
Yeah, I think it's vitally important. You know, again, we've talked about the rapidity and the efficiency with which the SARS-CoV-2 vaccines were developed. We've always contrasted that to things like RSV, where it has been 40 or 50 years that they've been working on a vaccine but unable to produce one. So this is very good news. Again, this vaccine was given to pregnant mothers. They were then able to create that immune response, and those antibodies were transferred to their newborn. And from the press releases, it seems like it's very good, an 80% reduction in severe illness for those newborns, because we know the newborns are most susceptible, highest risk of death should you go to the hospital and have severe disease. So I think it's very promising.
All right, let's check for reporter questions today. All right, Dr. Hawkinson, let's get to community questions, and I'm going to stick with you first. Okay. Ruth Ellen wants to know, are the home tests for COVID going to be effective with the new variants?
So far, we should. We know the FDA has recently updated some of the language with the home tests. It was updated, I think, several months ago, just saying that you may need to test serially for a few days. We know there was a pretty good paper in the JAMA network, or JAMA Internal Medicine, that showed you really had that highest sensitivity, the ability to detect the infection when it's there, at about 4 days after symptom onset, and that sensitivity was only about 75%. So you do need to probably test serially, probably test every 24 hours. The other option is to try and seek out a PCR test as well. But the original question, as far as we know, you should still be able to identify infection when it's there, with the caveat being you may need to test a couple days in a row.
Okay, Kim wants to know, Amy, maybe you can answer this one. Is varicose vein surgery covered by insurance?
Sometimes it is, and sometimes it isn't. There are varying different procedures that are covered by insurance depending on the patient's specific insurance and their actual diagnosis. But we have a great team of people that work on pre-authorizations to find to sort through what is the best way and the best approach for that.
Joellen wants to know, what's with those red spidery veins? I'm right there with you, Joellen. And what about flat blue veins in the legs?
Well, those are what we refer to as spider veins. They are defective veins in the skin, on the skin surface, which are a type of varicose veins. Those are the ones that aesthetically cause issues for some people, and in some people they can also cause symptoms. So we're very well equipped to treat those patients.
So Joellen's asking about flat blue veins. I don't know if this is what she means, but I'm going to just give a personal note. I have big veins. Is that like, will those eventually turn into varicose veins, or does that just mean you have veins close to the skin? What does that mean?
Well, there's a little bit of a difference between what we refer to as varicose veins and spider veins. Varicose veins are underneath the skin. They're greater than 3 millimeters in the standing position, whereas spider veins are actually in the skin surface, on the skin surface.
Gotcha. Okay, so Isaac says, I heard once you can get DVT if you sit too much. Now I hear you can get varicose veins if you stand too much. So what is the right balance, or is one or the other just as inevitable?
Well, Definitely, one of the risks for developing varicose veins is having a standing occupation. So we see a lot of hairdressers, assembly line workers, doctors, nurses, and they are all at risk. Certainly obesity is a risk factor. I think in terms of prevention, that exercise and weight control is something that everyone should be focused on.
So Mary says, I was surprised to hear Bob's story, as I've only known women to have varicose veins. Who's more likely to develop them?
Well, varicose veins are more common in women. The ratio is about 4 to 1. In our practice, about 1/3 of our patients are men.
Do we know why women? Does it have anything to do with carrying children, heavy weight? What does that mean?
Yes, pregnancy is certainly a risk. The changes that occur with pregnancy, the pressure of the fetus on the central veins in the abdomen, and the hormonal changes that we see with pregnancy all contribute to developing varicose veins, and it's usually more prevalent in patients who have been pregnant more than once.
Okay, Jeremy wants to know, are there simple things that I can do to avoid getting them, and are they reversible?
Yeah, there are some things that you can do to help prevent them. If you have a standing occupation, certainly wearing compression stockings is a benefit. Elevating your legs when you can if you're at home reading or watching television. And then again, watching your weight. Those are probably the biggest things.
Amy, any advice you give patients?
I think that the preventing is really to be able to maintain a healthy weight and to be active. I think that those are really important to be active. It helps with so many things. It helps with heart disease and so many other things. So maintaining an active lifestyle and a healthy weight are really important. And again, if you have an opportunity to, when you're sitting around in the evening, to put your legs up, that's helpful as well.
So Teresa has a question for Bob. When we see somebody with varicose veins, they're bulging, they look painful. Do they hurt? Did they hurt, or is it something that you see them but you don't feel them?
No, I think that there was some aching, and I didn't realize what it was. Mm-hmm. But I don't really remember like sharp pain or anything like that.
Okay, again, I want to make sure people check out the QR code. This will take you to the Centers for Advanced Vascular Care. So hover over that, click on it. You can find more information about our Advanced Vascular Care Center and more information about what we've been talking about. Before we get to our final thoughts, though, we need to find out a little bit more about Bob. If you have not heard of Trapp & Company, maybe you're not from the area. I'll just assume you're not from the area if you have not heard of Trapp & Company. It's just a beautiful, gorgeous, special place. Bob, tell us how you got into the floral business.
Well, I had decided I wanted to be an opera singer and graduated from high school and went to Wichita State University. Was majoring in voice, and I was taking summer classes. This was about my junior year, from a professor from La Scala at Friends University, and we were training to audition for the Metropolitan Chorus. And somewhere in the end of the summer and the end of the conversation, he says to me, how are you going to handle traveling and living in motels and hotels for the rest of your life? And you'll be gone 10 to 11 months out of every year. And I said, I can't do that. There's no way I can do that. So anyway, I decided, I called my folks from that night crying and said, I've made a terrible mistake. My mom and dad were both on the phone, and my dad just said, he called me Sonny Boy, said, Sonny Boy, that's your decision. We'll talk to you when you decide what you want to do. So I hung up, decided, I'm going home. Mm-hmm. So I packed up and took the train from Wichita and went home the next day. And it wasn't too long after that, the flower shop I had worked at was for sale, and we bought that. And I went to Colorado to buy Christmas merchandise, came home. My mother picks me up at the train station, hands me a letter, and she says, you're not going to like this. And I was drafted. Oh. So that changed the world.
Yeah, sure did.
But I had 2 years in the Army. It was peacetime, and they were probably 2 of the best years of my life. I learned about life and living with people.
I bet. You have quite a story. We're so glad you shared your story with us.
It's been a great life. It truly has. I've been blessed.
And just seeing you working in your store, and just, I call you an artist. You're a floral artist. What's it like when I bet you have people in town that come to you and only you to create these masterpieces, and just seeing you hard at work there is it's really cool to see.
Well, it's interesting owning this store 53 years. First of all, it's kind of rare for a business to exist 53 years anymore. A lot of my good, long-standing customers / friends, they all become friends, are gone. Mm-hmm. And so all of that changes, but I had 3 young men that I hired that have been with me. Kenneth's been there 40 some odd years. Stephen was 39, he just retired. Daniel's been there over 30, and they inherit the company. So they're moving on, and we're seeing their friends now.
New generation.
Yeah.
New generation of that. So, well, we thank you for making our city beautiful with your beautiful pieces of work for over a half a century. And
can I say one thing?
Absolutely.
One of the fun things at doctor's office, they told me that you have to put, they did it, the procedures one leg at a time, and they give you a cream that you have to put on your leg 2 hours before. So I had to get a neighbor to come over to help me. And so we're up at 4 in the morning, we get the cream on, and then you're supposed to wrap your leg with saran wrap. Mm-hmm. Well, we thought, so we tore off the saran wrap in sheets. So we're trying to wrap my leg with sheets. Well, finally, the second leg, my friend said, I think we just unroll it with the roller.
You got a new technique.
Yeah. So it all worked out, and it was a blessing, believe me.
Well, you've got many, many more years, and we're glad that you're feeling good and you've got those varicose veins taken care of. I know that was a scary moment for you in the shower, but we're glad that you found our folks. And we're going to get to final thoughts. And Bob, I'll keep it with you. What do you want folks to know?
Well, first of all, I think if you have bad varicose veins, which I did, I mean, I had spider veins and the larger ones, and they were all over my legs. That you get to someone. I mean, first of all, I guess you would talk to your regular doctor and say, what about all of this? And then they refer you to the right place, but just don't keep them and not get them protected.
Thank you so much for being with us. And definitely the sharpest dressed guest we've ever had. No offense to all of our other guests, but that's where it's at right there. Dr. Arnspiger, final thoughts from you.
Well, I would say that Bob is a fantastic patient, and patients like Bob that makes our job fun, as is working with such an excellent staff of nurses and medical assistants. I feel like it's a privilege to provide the patient care that we do, and I think we do an excellent job. We work very hard at it. Everybody is dedicated toward that end.
Doc, thank you so much. Amy, final thoughts, please.
Well, first of all, I wanted to thank Bob. We did we're blessed with a beautiful flower arrangement at the Vein Center. So thank you, Bob, for that, and thank you for being here. But one of the things about the Vascular Center that is so special, and the Vein Center in particular, is that with all these different procedures, we're able to do them all as outpatient at the Vein Center. So all the different procedures that Dr. Arnspiger talked about are done on an outpatient basis, and so it's really nice to be able to do that on all one place. That we have board-certified vascular surgeons, interventional cardiologists, and interventional radiologists supporting our Advanced Vascular Center really gives us the depth to be able to take care of all kinds of complex problems. And so, as Dr. Arnspiger said, very proud to be to work at the Center for Advanced Vascular Care and work with all the great folks that provide care there.
Yeah, getting people back on their feet, quite literally. Thank you so much, Amy. Dr. Hawkinson, final thoughts.
Yeah, I'd just like to echo what Amy and Dr. Arnspiger said, and we've said this before, it's so great to collaborate, and that's what you do get here at University of Kansas Health System, is that collaboration when it's needed between different specialties to help get you better and get you back home. And of course, we're also going to continue to endorse. We know, cases for SARS-CoV-2 are, about plateauing. plateaued, but it's still 260,000 cases a week. We know influenza is increasing, obviously RSV, so continue to endorse the fact that if you haven't had your influenza vaccine yet, please go get it. And then, of course, if you need to get that COVID booster, get that as well.
Doc Hawk, thank you so much. Please stick around and join us for another episode of All Things Heart coming up at 10 a.m. Today, we'll be talking about something called pelvic congestion syndrome. For months, a young woman from Joplin, Missouri suffered terrible discomfort and pain. She went to doctor after doctor, got the runaround, including one who told her the only solution was a hysterectomy.
I was not willing to accept that a full hysterectomy was my only solution.
So she did more of her own research and ultimately found a new doctor here at the University of Kansas Health System at our vascular center. That doctor not only diagnosed her quickly, but also had a procedure that promised to fix everything. It left her pain-free and it saved her heart. So bring your questions and we'll see you at 10 a.m. for All Things Heart. And thank you so much for being with us here on the Morning Medical Update. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Have a great day, and we'll see you back here Friday at 8. Coming up tomorrow on the Morning Medical Update. How does a cell phone app help doctors diagnose a concussion? These Blue Valley students could tell you. They just finished a test using new technology. I'm Jessica Lovell. This is one test students had fun taking. Join us Friday to learn who is taking the test and why, plus how it's helped already, especially with student athletes.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.